Hi folks, this is Dr. Rob Cywes. I'm the carb addiction doc. And today I'm going to talk about a problem that is way more common and people are frustrated by it. It's not that awful that they have to go and seek medication treatment, but it bothers them and it affects their everyday. And that is sleep, poor sleep. And when we look at poor sleep, I'm going to break it down into various categories. The first issue, particularly here in America, is we just work way too bloody hard. If you think about Europe, a lot of places in Europe are going to a 4-day work week. They're having much longer vacations. The philosophy in Europe is to work smart, not long. But in America, we still work ridiculously long hours. We're chasing the dollar. So our lives are a mess while we, especially in our middle years, where we sacrifice everything in order to be productive. And so the first step about healthy sleep is to look at your stress levels, look at what you do for self-care, and look at the amount of time you spend working, because the first thing we subtract from is adequate sleep. And that is the length of sleep. So we go to sleep later, we wake up earlier to get things done. That may be an issue. But as we look at sleep, finding time for sleep is the first thing. And that's obvious, that's pretty straight up. I'm going to leave that to each individual, but I would prioritize. As much as you prioritize, I've got to be at work, I've got to do this, I've got to do this, add to that list, I've got to sleep. And don't subtract from your sleep. Prioritize and protect the time that's available to you for sleep, whatever you believe is necessary. And as my father always said, a busy person can make the time. A busy person finds and makes the time. Be more efficient with your work. There'll be days when it's tougher, but make the time to sleep adequately, and you will be more productive the next day. It's an investment in productivity. Because you may work long hours, but you may not be productive if you're exhausted and you can't concentrate. The second thing is getting to sleep. And a lot of people have problems getting to sleep, so they can't fall asleep. And we'll talk about that. And then the next big one is I've got 2 or 3 or 4 hours of rest. I need 6 or 8, and I'm waking up in the middle of the night and I can't get to sleep. How do I deal with that? So let's talk about getting to sleep. And getting to sleep is in large part about brain relaxation. The brain needs to rest. The brain needs to chemically restore itself. That's what sleep's all about. So body restitution. And a few things about that is, number one, in our space, we don't want you eating carbohydrates. If you've eaten a bunch of carbohydrates, you may have a degree of somnolence. You may be asleep, all the blood going to your gut. But as you start to process those carbohydrates, let's say you had some ice cream for dessert, a few hours later, now your blood sugars are going down, now you're hungry, and now you're awake. So at first, after dinner, most people kind of fall asleep, or after lunch, most people who eat carbohydrates fall asleep. But 2 or 3 hours after that, boom, they're awake because they're looking for more. If you are in ketosis, if you're burning fat, you don't have that rise and hypoglycemic drop. It's kind of a flat line. So your nutrition doesn't affect that sleep. Secondly, if you're not eating carbohydrates, if you're fat adapted, you don't have the acid reflux, you don't have the LPR, you're less likely to choke when you lie down, you're less likely to have all the stuffiness in the back of your throat. It's more relaxing to go to sleep. So there are pragmatic aspects to being on a ketogenic diet that help you to get to sleep. The next thing is what's happening in your brain. If your brain is buzzing, if your brain is wrestling with issues, or you're worried about something, you're anxious about something, you ain't going to fall asleep. You know, when my wife talks finances 5 minutes before going to sleep, I know that I need to go take the dog for a walk because I'm not going to be able to go to sleep. So you try between dinner and bedtime to not deal with or not to bring up difficult issues. However, the flip side is to find something between dinner and bedtime, something that you can do for self-care, something creative, something not exercise, but something physically active, something spiritual or meditative that calms you down, that helps you to deal with emotional tension, letting the day go, and that helps you to resolve or process tough issues that you've wrestled with from during the day. And that's why what's sacrosanct in my own life is that before bed, walk with my dog. We both go outside. I know this is TMI, but we both pee outside. So my neighbors who have video cameras, go and check your video cameras. You'll see me and the dog both peeing. And that's okay. Arrest me. But it's part of my relaxation protocol. And we go for that stroll. It might be 2 minutes, it might be 5 minutes, it might be half an hour. Whatever my dog needs to poop, whatever I need just to chill. And then we come back and we get into bed. We take care of our ablutions, and some of them outside, some of them inside, and we go to bed. And that relaxation helps me to drift off to sleep. Usually I'm pretty tired from a hard day's work. We talked about at the beginning of this. And part of that is rearranging my day so that I have more free time in the evenings for self-care. Spend with my family, spend with my son, my wife, and get to sleep. So those are things that we can do to rearrange our lives a little bit so we prioritize sleep so I can have a better day tomorrow. The next thing is no screen time. I know this is no screen time between dinner and sleep. There are very, very few people out there that don't plop themselves in front of a TV before bedtime, after dinner. And let's face it, all you're going to see is one politician yelling at another politician. It's going to piss you off. You're going to get angry. It doesn't matter which side of the camp you come from, and you're not going to sleep. Whatever you watch on TV these days is going to piss you off. It's not going to relax you. Even if you're watching a sports event, you're getting all excited, even if your team wins. Watching some baseball at night, whatever it may be, soccer game. You're not going to go to sleep. So try to do something. Try to do something between dinner and bedtime that gives you a reward. Something that requires effort, where the payback at the end of that is a sense of well-being and a sense of, here's the word, accomplishment. If you feel that you have accomplished something between dinner and bedtime, you're going to get tremendously relaxed. It's psychology, it's an emotional psychology. But putting effort into something where at the end of it there's a sense of accomplishment will relax you, will get you to the point of sleep. And here's the chemical aspect of that, folks. When you're working at something, when you're doing something, you're creating something, when you're playing the guitar, when you're going for that walk, there's a degree of dopamine that gets released when you're focused on what you're doing. Initially, you start reading the book. And that's dopamine, focus. But then, as your brain kind of leaves that book, as you get in the monotonous enjoyment of listening to music, of saying a prayer, of meditation, of just strolling with your dog while the world dissolves around you at night, as you get into that meditative state while you're doing your thing, that relaxation begins to convert an amino acid, an essential amino acid called tryptophan. One of the 9 essential amino acids is a part of protein that we have to eat. Tryptophan goes to the brain, and in the brain, while you're focused on, while the world is dissolving around you, whether you're doing something creative, where you're having a wonderful, pleasant conversation with somebody, the human connection, whether you're doing something physically active, whether you're doing something spiritual, meditative, whether you're having sex, all of those things, those endorphin activating, relaxing things, will get the brain to begin to process the amino acid tryptophan, turns it to 5-HT, 5-hydroxytryptophan. From 5-hydroxytryptophan, it converts it to serotonin. Serotonin is the antidote for dopamine. So dopamine while you're focused, and then as you start to meditate and relax, serotonin levels go up, tryptophan becomes serotonin, serotonin levels come up, you begin to relax. And what happens with serotonin levels as they go up in the brain, as you relax, as you feel that sense of accomplishment, hey look, I read a chapter in the book. Hey look, I emptied the garbage. I came back from my walk with my dog. I had a wonderful conversation, played a game of cards with my wife. As you see that sense of accomplishment, what's happening chemically in your brain? Serotonin is being converted to melatonin. Melatonin. And that sense of accomplishment creates melatonin in your brain, and melatonin is your sleep hormone. So we've got both the psychology of relaxation through effort-based accomplishment and reward that is a relaxation, processing issues in your life, putting them to bed, but feeling a sense of accomplishment, feeling a sense of well-being that relaxes you. Okay? Think about the orgasm at the end of sex. That's part of that relaxation. It's part of that same serotonin, melatonin process. And when your melatonin levels are high, you're going to have a great night's sleep. You're going to fall asleep. And that's why the pharmaceutical industry has created melatonin as a supplement. I'm totally fine with people taking melatonin, just don't overdose. But taking melatonin to artificially elevate those levels is a sleep aid, and it does work. Is it powerful? No, because it's not your own melatonin, but it does help. Absolutely it helps. So I have no problem with people taking melatonin. Even something, and I would try this as an experiment, you don't have to do it, but don't keep doing it if it doesn't work, is a CBD gummy or something that relaxes you, not the CBD that gets you high, that gives you buzzing or creates the munchies, but there are forms of CBD that are used as sleep aids. I don't have a problem with that. I've never used it, don't need to use it, but absolutely fine to use. There's also medications like Ambien and then benzodiazepines. Not a huge proponent of that. I don't prescribe them. But those are okay because what's more important is the meaningful sleep. But again, I'm mentioning those. I'm not demonizing them. I'm not going to prescribe them. Don't come to me for a prescription. I don't know enough and I'm not comfortable doing it. But I'm okay with you doing that. Are the benzos addictive? Absolutely. So I know that's a bit controversial, but I'd rather you not need them. But if you do need them, I'm okay with that. Especially, and this is what I deal with as a patient population. If you bring, oh no, benzos are so bad. You've never walked in the shoes of a manic bipolar patient. So slap yourself and shut up. I'm not talking about regular people trying to go to sleep. I'm not just going to shove Ativan at them. But I have a number of bipolar patients who have that degree of mania, who have that anxiety, tremendous anxiety in the evenings. And whatever relaxation strategy they have, they don't work. I support under those conditions using something as an anxiolytic to get to sleep. I'm not a drug pusher. I wouldn't prescribe it myself. But pull your head out of that dark place and think about, in an empathetic way, everybody. Because as a physician, I treat everybody. And I don't want to tell some poor bipolar patient who's a little bit manic or someone with tremendous anxiety, no, you can't have the medication. That may piss people off. Leave comments. But don't leave comments about what you think. Put yourself in the shoes of that person. The manic person who hasn't slept for 3 days because they're so wired. If that's you, ask for help. And I have plenty of folks like that. It's not something to be ashamed of. In the right circumstances, if you have tremendous anxiety and you can't sleep because of it, if you have mania or hypomania and you can't sleep about it, let's do something about it. Don't be demonizing that. I don't want everybody to use it as a surrogate, but that's the spectrum of getting to sleep. Now, some people use red light, some people use blue light, some people use white noise, distractions. Some people leave the lights on, some people want pitch darkness, some people have little pillows and little huggies and little blankets. All good. Find your you, find your space in that. Experiment with all of those. Experiment with every one of them. Sleeping positions, sleeping aids in terms of pillows and blankets. But don't be a victim of somebody selling you something as magic. Don't be a victim and pay a lot of money for something that doesn't work. Try it out, experiment with it, but don't spend a lot of money on that crap. Same thing with blue and red lights. I can tell you I've been asked countless times to advertise blue lights or advertise red lights. I don't do that. I don't do that. Okay, so let's move on. Let's talk about waking up. I go to sleep, and this is a problem that I quite commonly have. Go to sleep, 2-3 hours of good sleep because I'm exhausted. Boom, I'm awake. Now, if you're older, I'm older, but I'm not there yet. If you're older and you're a male and you have a prostate issue, and you got to get up, or a female with urine issues, but if you have to get up in the middle of the night because you got to go pee, and that wakes you up and then you can't get back to sleep, that's a problem. If you're waking up because you have to pee, that's a problem. Go and get your prostate checked out. Let's do a PSA, go and see a urologist, and take action. Because at some point you're going to need that prostate taken care of. At some point you may need that bladder taken care of as a female. The earlier you get it done, the sooner you get it addressed, the better your sleep's going to be, the less severe the treatment has to be down the road. So if you've got prostatic hypertrophy, if you've got early prostate cancer, don't sit on it. Go and get it taken care of. I would pump the brakes a little bit with some of the bladder slings and bladder surgeries for females because they often don't work very well. Leave comments down below if you've had that experience. But certainly go and talk to someone reliable about it. Second thing, if you've got sleep apnea, central or obstructive sleep apnea, if you're snoring and wake yourself up and you're not getting good sleep, get a CPAP, get yourself tested. I just did a video with Sleep Doctor. Get yourself tested, test yourself at home. And if you've got sleep apnea, get the mask, but also be pissed off enough that you have to use the mask. If you're a little overweight, if you've got insulin resistance, treat your obesity, treat your insulin resistance, because you should be able to get rid of your sleep apnea or obstructive sleep apnea if you treat it. But wear the mask. If you are a perimenopausal female and your estrogen levels have plummeted, you may be waking up, you may be getting poor quality sleep, you may be exhausted, you may be fatigued, you may not be sleeping well. Go and talk to somebody about non-gynecologic, low-level estrogen and progesterone treatment. Low-level hormone replacement therapy. You don't need super high levels. It's not about libido or about gynecologic issues. This is about sleep. This is about exhaustion. This is about fatigue. And if your estradiol levels are unmeasurable after menopause, go and talk to somebody. Talk to me. Talk to somebody. 561-517-0642. Set up a consult. We can talk about that in a rational, cautious way. But absolutely, all of those things wake us up in the middle of the night. If you've taken a bunch of tough emotional stuff that you haven't processed to sleep, if you've worked really hard and you haven't done self-care, I can assure you that issue is going to allow you 2 or 3 hours of sleep, and then it's going to wake you up and your head is going to be buzzing. Because what happens if you take tough issues to sleep and you haven't taken your dog for a walk, you haven't resolved them before you go to sleep, that thing festers inside of you. You're exhausted, you get a couple of hours sleep, and then boom, you're waking up in the middle of the night and you can't get back to sleep because your head's flashing all over the place. And what do fat people do? They get out of bed, they go to the fridge or the pantry, and they eat something which is not in your best interest. Because now you're having hypoglycemia, you're feeding your insulin resistance, you're feeding your obesity, that's making your sleep worse. So whatever you do, don't go to the fridge and pantry and get something with calories to drink. You may be a little bit thirsty, you can drink a Gatorade Zero, some water next to your bed. Go and make yourself some broth, make yourself some peak tea that doesn't contain caffeine if you want something. But then the other strategy you can use, and it's an interesting strategy, is that when you wake up and your brain's rushing and you're awake and you're consciously thinking, you're triggering the beta waves in your brain. There are different wavelengths, different waves in your brain. And that is where you perseverate a thought, you're focused on one thing, and that is conscious thought. And beta waves keep you awake. If you think about dreaming, if you think about REM sleep, if you think about a dream is like discordant. It's crazy stuff. Where the hell did that come? It's crazy stuff all over the place. There's no association. And that is what delta waves do. Delta waves are associated with sleep. So one of the little tricks you can try in the middle of the night when you're trying to get back to sleep is think of random words. Tree, beach, thunderstorm, mathematics. Don't think of that. But think about a bunch of random words that are disconnected. And what that does is it triggers a rise in delta waves and a diminution in beta waves. And it'll help you to drift back off to sleep. Try it and let me know. But random word association may help you to trigger delta waves that help you to get back to sleep. But the best you can do to prevent that wake up is take care of the cause: sleep apnea, female hormones, prostate or urinary issues, and most importantly, tough emotional issues that you take to bed. Resolve those before you go to bed. The length of time you sleep is less important than the quality. And a lot of my folks on carnivore diets, because the quality improves, they don't need quite as much sleep. And then the final thing, the big thing that I personally do is 5:55. So one of the things I learned on a recent trip a couple of years ago to Poland, they have something called the 5:55 Club. And it just made all the sense in the world. So instead of desperately trying to get to sleep, and I don't know, even if you have a crappy night's sleep, what do people do? They hit the snooze button, they sleep longer in the morning. Now, okay, I feel a little bit better that day because I slept till 9 o'clock instead of getting out of bed at 5 o'clock. And I've got a little bit of rest, but now I'm not going to be able to sleep that night. And it's this perseverating transformation. No matter what, there's no circumstance under which I'm not going to get out of bed after 5:55 in the morning, usually 5:30. Why? No matter how crappy a night's sleep I've had, even if it's half an hour sleep because I've been operating, 5:55, I'm out of bed. And I'm exhausted the next day. But I can assure you I'm going to bed early and I'm having a better quality of sleep the next night. So I can make a correction within 24 hours instead of perseverating that over weeks. So 5:55 is a crucial thing. The other thing that 5:55 does is it gives you the opportunity to do some self-care when the rest of the world is still asleep. So I may have my cup of coffee, some meditation, some spiritual time. I may take my dog for a walk. I may even go for a run. So 5:55 is a crucial time point in my life. And I would urge you to find that time point, set that alarm clock. I don't even need my alarm right now. I'm up before that. But set that standard. Healthy sleep is not just predicated about when you go to bed. It's also predicated by when you wake up. And my wife and I have just had this debate about my son, who struggles sometimes to go to sleep. It's daddy, and I want to see everybody. And I understand his excitement. He's 3 years old. But if we get him up early in the morning, he's going to be tired enough that he's not going to be fussing and fretting. He doesn't nap anymore, fussing and fretting before he goes to get to sleep, which destroys our evenings. By 7:30, he's exhausted if he gets up at 6:30. So I'm up at 5:30, 5:55. Get my own self-care done, get him up at 6:30. We have some father-son time before I go to work. He has a good day, but then he goes to sleep early. It works for the kids, it works for the adults. If you're a night shift worker or a day-night shift shifter, that's the most challenging ones. But figure out a pattern, figure out a routine. Figure out what works for you. And don't take your shit to bed with you. Try to leave that on a walk while you're listening to music, while you're doing something creative. Process before you go to sleep. Don't bring them up, but process what's there. I am the Carb Addiction Doc. I know I've spoken about some controversial things. Leave comments. If you like the content of what we talked about, because there is no right answer, if you like the content, throw us a buck at our Patreon account, throw us a buck at our PayPal account. It's in the show notes. And if you like what we're doing, hit the like button, subscribe to our channel. And if you want to consult with me, 561-517-0642, leave a message, WhatsApp, phone, text, anywhere in the world, we can see you.